Hello everyone, my name is Audrey Meche. I'm a second year math student at Oklahoma State University, and I'm currently doing my clinical rotation at Tulsa Bone and Joint. The reason I chose Tulsa Bone and Joint is because I wanted to work on the therapeutic exercise side of things for athletic training. I really wanted to broaden my exercise library and, see how other people use different equipment and how they deal with certain injuries and how they rehab them. And at Tulsa Bone and Joint, I get just that. Tulsa Bone and Joint is pretty cool and unique because not only do they have physical therapy, but they also have hand therapy. So they have a few occupational therapists that work with patients on fine motor skills in their hands. So they have a ton of different supplies for that kind of stuff. And then we also have a ton of different supplies and equipment that we use for physical therapy. So we have stationary bikes, arm bikes, treadmills, a bunch of exam tables so that we can do like manual therapy, or if a patient needs to do, an exercise lying on their back or their stomach, we have different exam tables, some that are higher or lower depending on how the patient is, if they need a lower table to be able to sit on because they can't sit on a higher table. We have also different tables that adjust for height, so depending on if we need to work, they're a bigger patient and we need to have them up higher, things like that. We have different equipment, all kinds of TheraBands and TheraTubing, different kind of workout exercise balls, like weighted balls. We have giant physio balls, like sports specific balls, like baseballs, soccer balls, volleyballs. We have like steps. We have like 6-inch boxes, 12-inch boxes, some little step up boxes. So a lot of different equipment that all of the PTs can use for any different kind of exercises. I mean, just being here in the last 3 weeks, I've seen so many different exercises and different equipment used that I would have never thought of. So I'm definitely getting the good experience on that side of things. They also have some exam rooms. So for patients who come in for initial exams, we see a lot of patients who are either post-op surgery or just patients who have had like some injuries, strains, sprains, instability or weakness issues. So we do initial evals with them to kind of get going on the plan and things for them. It's really hard to get any pictures or a visual for the video because there are patients in the clinic from 7 o'clock in the morning till 7 p.m. when they close. And it is always busy. I think I get a few patients every week telling me, oh my goodness, it's, booming in here. There's just so many different patients because we have, I think, between 7 to 10 PTs and PTAs. So there's just a lot of patients going about in the clinic. So it was hard to kind of get a visual, but it's a huge gym. It's open concept, lots of different things for patients to do. And like I said, a lot of good experience. I think if you're looking for to broaden your exercise library or focus on therapeutic exercise side of athletic training, you're going to get a good experience here. Working with my preceptor, she's a physical therapist, but also an athletic trainer. So I get, a new perspective with physical therapy, but also she has the perspective of an athletic trainer. So her and I can talk about different things, focusing on athletic training. So I think it's a good place if you really want to, go into clinic or a more non-traditional route or just really focus on therapeutic exercise stuff. I think Tulsa Bone and Joint is a really good place to get that. So, yeah.